ब्लॉग्स नाम का सीरीज हमने स्टार्ट किया है इन पास्ट फ्यू मंथ्स, जहाँ पे एक एक स्पीकर आके एक रेमेडी या एक कंसेप्ट या आइडिया शेयर करता है सभी से, ऑल फ्री ऑफ कॉस्ट. So I thank you all the Unity members and all the other members from Aurangabad who has allowed me to uh, share little I know about bowel nosodes. So can we start, sir?
यस, रिकॉर्डिंग स्टार्टेड. रिकॉर्डिंग शुरू हो गई अभी.
Okay, sure. तो फर्स्ट थिंग बेसिकली bowel nosodes ये जो concept है, it is slightly different than our regular way of homeopathic prescribing. There are quite a few similarities and quite a few uniqueness about this group of remedies. Uh, it's been past 1.5 or 2 years मैं ये use कर रहा हूँ, और there is a huge difference in the results, positive differences in the results, even after when most well indicated remedies fail. Okay, so we'll do this session in three parts. First thing is I'll give you a very short history about bowel nosodes, because its concept is completely different, and it is inspired by works of Edward Bach and John Patterson. So the thing is, uh, this person, Mr. John Patterson, इन्होंने for almost 20 years, 20 साल तक, they studied a huge group of homeopathic cases, almost 12,000 cases, and they came to conclusions. Uh, they prepared medicines prepared from the stool samples of the patients who were given homeopathic remedies. So when we talk about bowel nodules, सबसे basic difference ये है कि it is not the kind of proving which we get from a Hahnemannian kind of proving which is done on healthy human beings. यहाँ पे ऐसा है कि they selected 12,000 cases who were already on homeopathic treatment for some or the other reason, right? And they started procuring stool samples of these patients, and they found that after giving certain homeopathic remedies, after an duration of 10 to 14 days, these patients used to their system used to eliminate bacteria or specific kind of bacteria used to come in huge concentrations in the stool samples. So what they did is they categorized this different class of organisms which came in the stool samples, and they potentized medicines out of it. तो उन्होंने क्या किया कि फॉर एग्जांपल 9 different categories of bacteria they found which were eliminated through the stools of the patients who were under homeopathic treatment. एंड देन दे कैटेगराइज कि फॉर एग्जांपल मॉर्गन पियर नाम का अगर कोई बैसिलस कोई ग्रुप ऑफ पेशेंट्स थ्रो कर रहा है, तो व्हाट कैटेगरी ऑफ मेडिसिन दीज पेशेंट्स हैव गॉन थ्रू इन द पास्ट, तो उन्होंने उसको कैटेगराइज करके एक टेबल फॉर्मेट में फॉर्म किया. ये सारा डिटेल विल गेट इन द एलन स्कीनोट के बैक साइड में बॉवेल नोजोट्स का छोटा सा पेपर है, विल गेट इट ओवर देयर. बट द थिंग इज, इसका शुरुआत कैसे हुआ? अराउंड इन द अर्ली 19th century, जब लुइस पाश्चर एंड ऑल दे केम अप, द कॉच postulates, these things came up. तो बेसिक मेडिकल साइंस जो इवॉल्व हो रहा था, उनका बेसिक प्रिंसिपल ये था कि देर इज अ स्पेसिफिक जर्म विच कॉज अ स्पेसिफिक डिजीज, जिसको हमारे ऑर्गन में टोले कॉज हम बोला है कि यू हैव टू हंट फॉर द कॉज एंड देन look for the medicine, right? On the same values, the same principles, medical science, the modern medical science is also going ahead. Whatever vaccines are prepared from the organisms which cause it, and as a preventive they are given. Similarly, nosodes that we use frequently, the sorinum hua, medorinum hua, these are also derived from the disease products, right? Similarly, there are certain things we have to understand. The very basic principle about this bowel nosode is that there are three things. The first is there are non-lactose fermenting bacilli which are present in the stool, which goes unaffected by the digestive juices, and they are eliminated, right? So the our whole of the bowel flora is home to multiple varieties and kinds of bacteria which live homogeneously with us. They are non-pathognomic to us. But but when the patient when the patient goes under some uneven circumstances because of which the bowel flora changes, or there is an excess of certain symptoms which forces the bowel flora to go into an excess or in a low, which causes the troubles. So basically what they had concluded that these pathognomic organisms is a result of the vital actions of the human being. Is it clear? If a person is getting affected by, for example, a cold weather, that cold weather or certain things what he has eaten is causing some trouble to his daily physiological activities, which will cause some kind of imbalance between the uh, individual, the person, and the bowel flora. तो bowel flora का और जो intestinal mucosa का जो balance है वो जब बिगड़ता है, either bowel flora का quantity increases or it goes down, and which is a result of the vital reaction of the body of the patient, right? So what they postulated was, out of 12,000 cases what they studied over a period of 20 years, 20 साल तक they studied, and they categorized and they came to certain conclusions. तो पहला conclusion ये है कि there is a specific organism related to a specific disease. पहला conclusion ये है. For example, if we say there is a cholera which is affecting a patient, and we see there is a uh, cholera ka bacillus which is found in the stool sample. So that is one example. Second thing, there is a specific organism having a relation to a specific homeopathic remedy or a group of remedy. क्योंकि what they studied is there is a group of medicines जो जिन patients को गया है, वो group of patients को similar type of organism ही eliminate हुआ है, right? And the third thing that they postulated was the homeopathic remedy is directly related to the disease, which means there are certain homeopathic remedies which will cause certain kind of disturbances in the bowel flora, which will later on be labeled based on the symptoms as whatever disease label can be given to, right? तो uh, उनका बेसिक जो पूरा थियरी है, it is only based on that there are bowel organisms which are naturally present in the body, but when a person or the individual is given homeopathic remedies, certain organisms multiply in number and they're eliminated out of the body as under the effect of a homeopathic medicine, right? तो इसके अंदर हम लोग केसेस भी शेयर आई शेयर यू. तो पहला चीज वी हैव टू अंडरस्टैंड इज, when we are thinking of using vowel nosodes in practice, it is not the kind of method usually used with the totality or usually with the constitutional. तो hello, right? So first things first, we'll go one by one with the medicines, and I'll try to explain how we can establish the relation with the our prescription. And तो सबके पास में एलन की नोट रहेगा ना, तो लास्ट पेज ओपन कीजिए. देयर इज अ चार्ट ऑफ दिस बावेल नोजोड्स एंड अ ग्रुप ऑफ होम्योपैथिक रेमेडीज, राइट? तो व्हाट वी अंडरस्टैंड फ्रॉम दिस चार्ट इज देयर आर 9 कैटेगरीज ऑफ ऑर्गेनिजम्स जिसका उन्होंने नोजोड प्रिपेयर किया हुआ है. तो देयर इज अ Morgan pure nosode or a mutable nosode or cytotic compound nosode. उसके against we will get a category of homeopathic remedies which has affinity for that nosode, right? So for example, if you are having a chronic case which is stuck since a very long time, what you would do is you'll go back to the previous prescriptions and see what group of medicines are being given to this patient very frequently. For example, there is a small kid having some hyperactive issues, malnutrition issues, some constipation and diarrhea issues, dentitional issues, right? और आप क्रॉस चेक करते हो कि बाबा क्या ग्रुप ऑफ मेडिसिन पहले गए हैं, तो यू विल फाइंड कि एट सम पॉइंट ऑफ टाइम द किड माइट हैव रिक्वायर्ड मर्क्सॉल, at some point of time the kid required silica or phosphorus compounds or calcarea phos, right? But what will happen is, uh, there are certain group of symptoms the patient keeps on coming to you कि resolve ही नहीं हो रहा है. Just for example, a cold catching tendency. Rest of the malnutrition issues are settled. Rest of the hyperactivity symptoms are settled. The GIT disturbances are settled. Cold catching tendency जा नहीं रहा है. Basically, as our regular practice, what we will do, we'll look for the group of symptoms which the patient is not responding with these regular medicines. We'll look for a miasm. We'll try to find an intercurrent, give it, and go back to constitutional remedy. Usually, this is something that we practice. But over here, if you go look into this chart, you'll find against this remedy, Gartner back this group of remedies. जहाँ पे सामने फॉस्फोरस लिखा है, सिलिका लिखा है, मर्क्यूरियस लिखा है, कलकेरिया कलकेरिया फॉस कलकेरिया फ्लोर, ये ग्रुप ऑफ रेमेडीज दिया है. And when you try to read this group of remedies, you will find the chief the chief keynote of this nosode, Gartner nosode, is malnutrition as a theme in itself, where the child is hyperactive, where there are certain groups of symptoms which are quite obstinate, which are not resolved with the regular medicines. So similarly, how we use an intercurrent, for certain duration, we'll have to use the doses of Gartner back in such patient, maybe in 200, maybe in 1 m, use it infrequently, and then again go to the remedy which acted the best for the patient. Right. तो हम स्टेप बाय स्टेप बहुत शॉर्ट में ना सारे बावेल नोजोड के है ना जो की नोट्स है या सेंट्रल थीम्स है उसको थोड़ा सा फोकस करने का कोशिश करेंगे. तो इन द एंड जब हम केसेस डिस्कस करें तो हमको थोड़ा इजी जाएगा समझने के लिए कि हाउ इट एक्चुअली इज अप्लाइड इन प्रैक्टिस. मैं पिछले कम से कम 1.5 साल से या 1 साल से ये प्रैक्टिस कर रहा हूँ, ये चेंज किया है. There were certain group of patients which were not actually getting relieved by even retaking the case, changing the medicines. Constitutional was helping, not holding, relapses of cases. Anyways, so first group of medicine is the Morgan back group of remedies. इसके अंदर दो कैटेगरी ऑफ मेडिसिन, एक मॉर्गन प्योर, एक मॉर्गन गार्टनर. Right? When you will go through this Morgan group of remedies, we'll find that maximum number of polychrosts are written against this remedy. For example, sulfur is mentioned over there, basilinum is mentioned over there, soranum is there, calcarea group is there. Most commonly used medicines are mentioned. Even petroleum, sepia, and carbon group is also there. Kali carb, mac carb, natrum carb. So when we are understanding this categorization of group of remedies, you'll have to thoda sa keep in mind the understanding of group understanding of remedies. Calcarea group के features, carbon group के features, sulfur group के features. You'll have to keep that in mind. क्योंकि the reason is the literature which is available about bowel nosodes is very much limited. Over here, the physician has to rely on what are the group of symptoms which is centrally happening with the patient again and again repeatedly chronically for years together, which is not getting answered by the regular homeopathy. Right. So the first thing about this Morgan group is congestion is the keyword of this group of remedies. The congestion has to be on the physical level, on the mental level. There has to be anxiety, there has to be depression, there has to be multiple fears, right? And when we are talking about congestion on physical plane, there has to be severe congestive headaches, there has to be congestion of the intestinal tract, there has to be congestion of the respiratory tract, and you have to understand that that congestion in a very broad spectrum, not just tender hai ya fir hot hai, not in that sense, but in a so when we are talking about this group of remedy Morgan Pure, so there is always a polycrest associated with this bowel nosode, which would be a polycrest, which would be having a bigger picture of polycrest symptoms, which will associate with other group of symptoms. इसका मीनिंग ये है, फॉर एग्जाम्पल व्हेन वी आर सीइंग मॉर्गन प्योर, उसका चीफ जो स्फीयर है, स्फीयर ऑफ एक्शन है, इट इज स्पेशली स्किन एंड liver, skin, liver, and gallbladder. So when you get congestion of skin, when you get congestion in the liver, when you get congestion of the gallbladder, which later on causes gallstones, right? There are congestive headaches with hypertension, which causes vertigo, giddiness. This congestion in the gastrointestinal tract will cause a rise in the bilious symptoms. more bile, more bitter vomiting, more acidity, these kind of symptoms. You have to correlate that, right? So there is marked skin symptoms with liver complaints, right? But over here in Morgan Pure, this congestion in all these levels has to be very chronic, not acute. So if you are, for example, you are having some patient who is having, say, a fatty liver is there, is having hyperlipidemia, or the same patient is having some bronchial issues when change of weather is there, उसको asthmatic कुछ complaint होता है, just for example. And over a period of time, over a long time, you have used medorinum in the case, you have used sulfur in the case, you have used natrum carb or calcarea carb in this case. But if you try to wait and watch and you try to understand, there are certain groups of symptoms coming and relapsing again and again. There are certain groups of symptoms which are alternating again and again. Gastric symptoms and headache symptoms are alternating again and again. You have to understand, even after using miasmatics, if you see sulfur, medullum, soranum, even tuberculinum, most of the main anti-miasmatics are there. वो रहने के बाद में भी अगर complaints relapse हो रहा है तो there is something beyond miasm which is hindering the healing process. ये समझना जरूरी है क्योंकि आप जब बावेल नोजोड का थोड़ा इंट्रोडक्शन पढ़ोगे ना, उन्होंने कुछ थ्योरी इस तरह से मेंशन किया है कि there are certain bowel organisms which do not get eliminated out of the body and which causes barrier between the sickness and the individual. Unless and until those group of organisms are not eliminated out of the system, your medicines will not penetrate deeper enough to bring a cure. इसका मीनिंग ये है, right? So when you understand this correlation in such a case, वैसे टाइम पे आप ट्राई कीजिए, you give bowel nosode of Morgan Pure 200 या 1 mk doses, you wait and watch, and after you are given those doses, see if there is a secondary action what comes. Many times there will be no action, no change, no difference. Patient will say there is no difference. On in that situation, you have to review all the previously given medicines which acted the best. For example, ऐसे केस में आपने काफी सारे मेडिसिन दिए, उसमें से काली कार was the medicine which helped the patient the best at some point of time. So the medicine which gave the best result in the past, maybe present symptoms के अंदर उसका totality में medicine ना भी आ रहा, you'll have to use that medicine after using a bowel. Okay. So going ahead, the second category of this Morgan group is Morgan Gartner. Morgan Gartner and Pure में एक ही difference है कि Morgan Gartner is a medicine where there is acute colic complaints. But when you are studying Morgan Pure, you'll nowhere find anything mentioned about the kidney stones or kidney stone colic, but you'll find it in Morgan Gartner. For example, I'll share very shortly. I had a patient who was with kidney stone complaints for almost 8 or 9 months. I had used multiple medicines. I had used mother tinctures. I had used constitutional medicine. There were 2 or 3 intercurrent medicines which were used. After all those efforts, there were certain group of UTI symptoms coming up, going bad. कुछ colic complaints आ रहे थे, जा रहे थे, पूरी तरह settle नहीं हो रहे थे. After understanding all those things, I came down to using Morgan Gartner in that. And to my surprise, जो मैं treatment 8 9 months से run कर रहा था, after using Morgan Gartner, the patient eliminated stones after 2 or 3 weeks of giving Morgan Gartner. There is one another interesting thing. When you are getting a mixture of symptoms of a huge group of remedies, mixture of symptoms. आप जब मॉर्गन गार्टनर पढ़ते हो ना, उसका कोरिलेशन वाला जो मेडिसिन है वो लाइकोपोडियम. तो अदर मेडिसिन लाइक लाइकोपोडियम, चेलिडोनियम, चेनोपोडियम, लेकेसिस, टैरेक्सेकम, sanguinaria, all these group of remedies. For example, you are getting टैरेक्सेकम का टंग मिल रहा है, उसके बाद में गैस्ट्रिक हेडेक मिल रहा है, राइट साइड एड्रिनल कोलिक मिल रहा है, आपको हिस्ट्री ऑफ से जॉइंडिस मिल रहा है, all these symptoms. But if you try to understand, all the group of symptoms would be a mixture of symptoms of multiple remedies of a certain group or certain category. So many a times vowel nosodes also help to clarify a layer of symptoms which causes you confusion to come to a remedy. बहुत बार होता है. Okay. Going ahead, another group of vowel nosode is this Proteus back. And when you are studying Proteus back, it is very important कि आपके patient में, आपके case में, there has to be suddenness of symptoms. suddenness of symptoms at the level of central nervous system and peripheral nervous system. Abhi, there are certain symptoms which would be clinical symptoms, not even PQRS, but disease specific. For example, Raynaud's phenomena है, उसके अंदर claudication of fingers है, deadness of finger है, tingling numbness of fingers है. You get this usually in this phenomena where you don't even consider any symptoms. Emotional hysteria has to be there. If there is a history of seizures, if there is a history of convulsions, it will be indicated. Another thing, if you can understand this thing on a general level, there has to be spasms at the level of circulation. If the spasms happen with the circulation, then the peripheral nervous system, you'll get claudication, you'll get tingling, numbness, all these things. If it happens with the cerebral circulation, Meniere's disease वगैरह, जहाँ पे vertigo वगैरह you'll get as a picture, because the brain circulation is affected. Another thing is prolonged nervous strains. If there is a category of people or category or group of people who are or the patient who is very prolongedly affected by grief, prolongedly affected by some financial stress, जिसको हम न्यूरास्थेनिया वगैरह इस कैटेगरी में बाद में हम यूज करते हैं, जो एसिड फॉस के ग्रुप वगैरह में आता है. In those conditions where the patient has tendency to ulcerations, repeated duodenal ulcerations, ये कैटेगरी ऑफ ये कैटेगरी ऑफ सिम्टोमेटोलॉजी आपको मिलेगा. तो यूजुअली यू शुड फाइंड कि मेडिसिन आनी चाहिए. If you try to study the chloride metabolism in biochemistry, बहुत डिटेल में जाएगा ये, पर if you try to once understand the chloride metabolism and you try to understand that symptomatology and this symptomatology, you'll find a lot of similarity. So in this group, you'll find correlation of medicines like natrimor, you'll find correlation of symptoms like ignatia, whole muraticum group, ammonium more, aurum more, kali more, mag more, cuprum metallicum, apis. If you're talking about spasms, no, if the spasms at the central nervous system level, what the first medicine we think is usually is a cuprum metallicum. Angionetic edema अगर रहता है तो there is something or herpes रहा तो we think of apis. But when you understand that there is a repeatedly herpes is occurring again and again, apis is helping sometime, it is not helping sometime. There are medicines like kalimur helping sometime, natamur helping sometime. This category of medicine is coming up again and again, but there is no proper symptom picture indicating to just one medicine. In that situation, to clear up this block, you'll have to require certain doses of protease pack. Okay. Coming ahead, another group of another bowel nosode that we come across is bacillus number 7. Abhi bacillus number 7, if you have to understand, you have to simply understand only one simple theme. The theme is there is complete physical and mental exhaustion or prostration, where the patient has no capacity to take any mental effort, or too much of mentally drained, too much of emotionally drained situations for very prolonged time, which causes these patients to become despondent or depressive, these kind of states, right? But इसका जो central theme जो रहता है is basically fatigue. I'm unfit to do any physical work and I'm unfit to do any emotional work or to involve myself emotionally also. These are a category of people who become very much irritable, very much cross. So there is a certain category of medicine which comes very close with correlation of bacillus number 7, which is bromine, iodine, and kali group. The combination of these three, kali brom रहेगा, kali iode रहेगा, natrum iode रहेगा, calcarea iode रहेगा, right? Or if you can categorize kali bichromicum है, kali carb है. So basically, you understand this group of medicines are very much irritable kind of temperament. Yes, Dr. Deepali is saying it is due to a lot of fatigue. Yes, ma'am, you're right, absolutely right. But what I'm trying to tell you is these are there is a caution about bowel nodules not to use these medicines as the first prescription. Not to use. After these group of certain medicines which are correlated with these bowel nodules, Once you are able to use one, two, or three group of those medicines, and when you understand there is a block with certain group of relapsing symptoms, that is the time when the indication for bowel nosodes come in. I have failed miserably using certain bowel nosodes as a first prescription and patient gives bhayankar aggravation. Don't try to do that. It might seem very simple कि ये category of symptom है तो table में देख के दे दो, but that is not the thing how it goes. Bowel nosodes have indications when there is a mixture. ये आप लिख के ले लीजिए please. There is a mixture of group of symptoms of multiple remedies where you are not able to decide. Meeting will close temporarily. Please join again. Okay, sure, sir. Thank you, sir. So when you are having, for example, if there is a patient who is having recurrent tonsillitis, you have used certain medicines, अपने कलकिरिया group use किया, iodine group पे है, certain times bromium का indication मिला वो दिया. But ये जो relapsing वाला ये जो situation है, even after using antimiasmatics like Thuja, वो that is not getting result. That is the time you will require bacillus number 7. Another thing about bacillus number 7 is what I understood is there was a case I was having where the patient was having very high uric acid and non-specific joint pains. Non-specific joint pains with high hyperuricemia. In that case, after failing with three or four medicines and one or two mother tinctures, which gave very temporary relief, Bacillus 7 I gave that patient in 30 potency frequent repetition, just like any other medicine. And to my surprise, the the uric acid, which was around 8 or 9, it directly came down to 3.5. So, what they have written about the introductory lecture of this Bobby Nuzad is that there are certain blocks which are not perceived. You see, in today's times, what we are understanding and getting is everyone out there is talking about gut health, improving the gut health, improving the gut flora, right? And even Ayurveda believes in this thing that when there is problems with the digestive system, a lot of the diseases come in. Many of the chronic diseases have the origin from the stomach. ये सब चीजें आयुर्वेदा में भी बोला है. So when someone has actually done a proper work of 20 years of time, someone has put in using 12,000 cases in, so sometimes you have to take a different part to look at cases. Okay, 2:40 हुआ है, शायद मीटिंग क्लोज होगा तो we'll join again. Okay, going ahead, will not waste time. Gartner back is another group of medicine, another bowel nodule. इसके बारे में मैं सबसे पहले बात किया. The whole theme of this Gartner back, where you'll require this medicine, is malnutrition at the level of anemia, malnutrition at the level of mental development, malnutrition at the level of physical development, stunted growth. The kind of patients or the kind of children जिनको nutritious food देने के बाद में भी there is no growth. We all know those category of patients. But the medicines which have the similar combination or group of symptomatology which goes very close with this Gartner is phosphorus, mercurus, and silica. Every one of us knows phosphorus, mercurus, silica. All these are basically category of medicines which are having tubercular taint in them, right? They are most of them are hypersensitive as children. Overactive brain is there. So curious children who are destructive in habits will kick and throw things. There are impulses. ये सब पिक्चर अपने को टैरेंटुला जैसे पिक्चर में मिलता है. अभी यहाँ पे टैरेंटुला नहीं है, इसका ये मीनिंग नहीं कि टैरेंटुला अगर चालू होगा या ब्लॉक आता है तो ये नहीं देने. There is a group of things that they have done back in 1936, around 100 years ago. But it's our moral duty to understand the theme of the nosode. And if we are even using, for example, tuberculinum, which is not there in the category of this Gartner back, right? Maybe the tuberculinum is present against Morgan Peer. But आपको patient को tuberculinum चालू है, if there are still some relapse of symptoms, we are seeing a general malnutrition का picture in that patient, which is not getting better after using tuberculinum. Use at that time Gartner, even though it is not in the category of that table. Don't take it as a thumb rule key. If this is there, only this group of medicine is there. No. If in that case of malnutrition, maybe you are requiring a medicine like Baratakar, use it. But if you are getting that theme in that Baratakar patient of malnutrition, hyperactivity, destructiveness, impulsiveness, There is inability to digest fat food. The patient vomits anything which is of a fat food origin is given to him. There is a history of threadworms in such patient. You use the medicine gut.